This patient was referred to me for evaluation of tooth number 7. According to the patient, this root canal was done a few years ago by her previous dentist. Patient says she has had no problems, no issues with this tooth whatsoever. But she's at my office. Her dentist referred her to me because the dentist saw a periapical relucency here. So let's analyze this tooth. Upon examination, porcelain crown, fiber post, previous root canal, extruded sealer, which is fine, periapical relucency. Is this a true infection? Should I jump in quickly and recommend endodontic retreatment? No, this patient has no symptoms. If patient has symptoms, yes. So what do I do in this case? Just like what I always do, and I've posted those videos. I find who the previous dentist is who did the root canal, and that's what we did. We were able to locate the dentist who did the root canal, and we were able to get x-rays. Now, if on his x-ray I see that there is no periapical relucency when he did the root canal a few years ago, and now there is one, then that means that this patient, despite not having any symptoms, has an active infection. But if there is one when the dentist did the root canal a few years ago, and the size is exactly the same size that it is today, or it was much, much larger and it's gotten smaller, then we don't do anything. And that's what we did. Let's look at the x-ray from the dentist. And here it is. This is the x-ray that we got from the patient's dentist. As you can see, there was no periapical relucency. None. This x-ray is from 2019. So, no periapical relucency. And now, there is one. So this is an active infection. We need to redo this root canal. And here it is. So today, went through the porcelain crown, removed the fiber post, removed the gutta percha, and irrigated the heck out of the canal system with full strength hypo, activated sonically and ultrasonically. The apical diameter was over 50, so placed an MTA plug, followed by gutta percha and sealer, temporized the tooth, referred the patient back to her dentist. Actually, patient has an appointment with her dentist today at 1 o'clock. So here it is. This is how you do it. Don't jump into treatment right away. You need to do some investigating sometimes. Patient came to see me in 2 months just for a post-op, for us to see how things are developing. And take a look here. This is 2 months post-op of tooth number 7. Take a look here. This was before I redid the root canal 2 months ago. And take a look here. That's the date, 1/4/2023. Look at the size of the periapical relucency. And this was just a couple of days ago. And take a look. This is 2 months post-op of the tooth, and the periapical relucency is so much smaller already. That's the date, as you can see. Zooming out so you can see the difference. 2 months ago, just a couple of days ago. 2 months, and already there's so much bone deposition, so much healing as compared to 2 months ago. Excellent. I'm very optimistic about this tooth. We avoided a surgical treatment.